Hello, I'm Dr. William Richardson of the Atlanta Clinic of Preventive Medicine, and today I want to talk to you about IV-Chelation Therapy, the ultimate in heavy metal detoxification. What we're talking about is heavy metal pollution of our cells and the earth. You see, since the beginning of the Industrial Revolution, Earth's environment has grown continuously more polluted. And you know what? Over the past several decades, that we've seen alarming evidence that the pollutions, the heavy metal pollution's latest victim is the human organism. That's you and me. Today, millions of Americans are suffering from environmental illnesses, of which heavy metal poisoning is and may pose the greatest threat. Heavy metal poisoning has become an often overlooked, misdiagnosed illness that can be a major root underlying cause of the epidemic of chronic degenerative illnesses that are plaguing Americans today, including cancer, Alzheimer's, arterial sclerosis, which means hardening of the arteries, heart attack, stroke, circulation dysfunction, arthritis, digestive problems, chronic fatigue, multiple sclerosis, autoimmune diseases, depression, sarcoidosis, and many, many others. Again, this heavy metal poisoning is associated with cancer, Alzheimer's, arterial sclerosis or hardening of the arteries, heart attacks, all these illnesses, sarcoidosis, chronic fatigue syndrome, autoimmune diseases. Heavy metal poisoning. Heavy metal poisoning, folks, is inundating our society with exposure to free radical damage. It's gumming up the enzyme systems, and we're going to talk further about this. In fact, folks, heavy metals, including lead, mercury, cadmium, arsenic, aluminum, and nickel, those are just a few, but those are the most common. These heavy metals can contribute to, or mimic almost any illness that includes the well-known diseases previously just mentioned, as well as mystifying disorders that result in almost any physical and mental behavioral problem. Heavy metals do their damage on an unseen microscopic level. Basically, heavy metals disturb the functioning of specific essential vitamins and minerals that result in malfunctioning of enzymes dependent on these vitamins and minerals. As the enzymes are poisoned, our cellular and metabolic functioning systems become compromised and inefficient, meaning they're less effective. The popular term for this general effect is free radical damage, where our own cells and atoms become microscopic bullets that destroy and break down our own body systems. What we're talking about is a microscopic assault on our bodies. It's a microscopic pollution from heavy metal toxicity in the environment. Now, I would like to talk to you about common symptoms of heavy metal accumulation in the body. Lots of symptoms. Common symptoms of heavy metal accumulation in the body include fatigue, headaches, depression, emotional disturbances, behavior disturbances. We think of ADHD, lower intelligence, diminished memory, dementia, gastrointestinal problems, immune system dysfunction, high blood pressure, heart disease, chest pain, liver and kidney disease, and even cancer, just to name a few. This is a great problem. Obviously, massive heavy metal exposure from industrial and occupational accidents can cause severe acute illnesses and even death. However, we must not underestimate or overlook the fact that persistent low-level pollution has dire effects on the body. This environmental exposure to heavy metals do their damage at a microscopic level, as previously stated, providing common everyday symptoms or life-threatening illnesses ultimately that conventional doctors just may not be aware of. Most of us have been exposed to heavy metals. Two very important questions one must ask themselves about the subject. How can you know definitely if you are suffering from heavy metal toxicity? Yeah. Secondly, how do we get these toxic metals out of our bodies? That's just what we're going to be talking about, and I plan to answer those questions for you. Looking at it from another perspective, after doing all the standard exams and running all the standard blood tests and running even more invasive standard diagnostic tests, your conventional medical doctor may not readily consider your reoccurring unexplained headache, fatigue, depression, mental dysfunction, digestive disorder or immune system dysfunction, and a host of other health concerns and issues previously mentioned as a result of this heavy metal poisoning. You see, standard first-line tests using blood and urine will usually not detect heavy metal poisoning. And why is that? Because heavy metals lodge themselves in intracellular spaces inside the cells rather than in the blood or urine. And therefore, they can have large accumulation, standard tests showing nothing. Folks, your standard medical tests as well as frontline tests for metals, in other words, just taking a blood sample or urine test without provocation, and we're going to explain that, without the EDTA provocative testing that we do, will not detect heavy metal disease. Your doctor will tell you you're fine. What we're talking about here is EDTA IV-Chelation Therapy challenge testing. It's very useful, and it's far more useful and very effective method for testing heavy metals. The chelation challenge test, where we intravenously inject EDTA, standing for ethylene diamine tetraacetic acid, pulls heavy metals out of the tissues and then into the blood and urine, where they can be excreted and measured. A 24-hour urine sample is collected, which is sent to the lab, yielding definitive results as to whether you have heavy metal toxicity above normal ranges. And guess what? Most of us do. I even have had mine measured and definitely have heavy metal poisoning. My brother, my mother, most of the clinic participants and patients do. Smoking, industrial exposures, just breathing the air can give it to you. Polluted food, all those things. Now I'm going to explain to you how EDTA works. Exactly what does EDTA chelation therapy do? Chelation therapy is an IV or intravenous therapy using a synthetic amino acid, EDTA, which has the ability to bond or hook onto atoms of calcium and heavy metals, lead, cadmium, mercury, arsenic, etc. And these heavy metals are then eliminated through the kidneys into the urine and feces. Chelation therapy is used for patients with heavy metal poisoning, poor circulation due to arterial sclerosis, and conditions related to both of these primary diagnoses. That includes heart disease, dementia, etc. In heavy metal poisoning, varying symptoms are experienced, and as blood levels are lowered, tissue levels are lowered, and the symptoms usually subside. Chelation therapy has been shown particularly effective in reversing arterial sclerosis, where the blood vessels are damaged and obstructed by the buildup of plaque. During and following chelation therapy, there is conclusive evidence that this plaque is dissolved very slowly and the blood flow throughout the body improves, thus dramatically improving a host of cardiovascular symptoms and diseases. And this includes, of course, heart attacks, strokes, heart disease, hypertension, heavy metal poisoning, chronic fatigue, Alzheimer's, senility, arthritis, osteoporosis, multiple sclerosis, cold and hands and feet, diabetes, and cancer. Do certainly use EDTA-Chelation Therapy for cardiovascular diseases like coronary heart disease. But I want to emphasize to you that it is also beneficial for autoimmune diseases, for arthritis, for emphysema, for gastrointestinal problems, and probably a whole host of diseases. Now, what are the results of chelation? The results are as varied as patients' conditions, of course, but improvement is usually achieved and favorable results can be dramatic. Laboratory tests and office visits for evaluation will monitor your progress, and I will change your therapy as needed as you progress through the treatment. Chelation therapy is useful in treating current illnesses and symptoms, as well as being a life extender and preventer of future lurking health problems. Now I want to talk to you about getting IV-Chelation therapy properly and effectively. You know, millions of citizens, including celebrities and doctors, and myself, in the United States have used EDTA-Chelation therapy. Over 1,000 medical doctors in the U.S. and worldwide use chelation therapy to treat cardiovascular illnesses as well as other diseases we mentioned. Chelation therapy involves numerous, at least 20 or 30, and often many more, intravenous infusions over a course of treatments in a doctor's office. Chelation therapy patients also are generally advised to take comprehensive approaches to their treatment of health, including as needed diet, exercise, stress management programs, and dietary supplements. As with any medical treatment, patients should ensure that their treating physicians have appropriate training and credentials for the administration of EDTA-Chelation therapy. Competent, experienced chelation doctors are members of the American College for Advancement in Medicine and are certified by the American Board of Chelation Therapy. I have obtained both of those goals and am indeed certified by the American Board of Chelation Therapy and have had the proper training through the American College for the Advancement of Medicine. Should I get in there first? Now I want to emphasize to you the sources and the symptoms of heavy metal toxicity. Sources and symptoms of heavy metal toxicity. Make no mistake about it, many of us have been exposed, in fact most of us have been exposed to heavy metals and are carrying heavy metal toxicity in our bodies as we speak. If you have unexplained or recurring symptoms or illnesses that won't go away and won't respond to treatments, you may have heavy metal poisoning. For instance, a big one here, if you were a previous smoker or exposed to heavy secondhand cigarette smoke or industrial pollution of any kind at any time in your life, even 10, 20, 30, 40 or more years ago, then you are a prime candidate for heavy metal toxicity. In my experience, virtually every one of my patients that was a previous smoker tested positive for heavy metals. I want to re-emphasize that cigarette smoke is a major culprit to heavy metal toxicity, and recent studies have shown that even short times of smoking can increase your chances of cancer 10, 20, even 30 years from the time you stop smoking. So it's very important for every smoker to be tested, previous smoker or current smoker to be tested for heavy metal toxicity. And it's not only smoking and smokers that are at risk here. We're talking about industrial pollution worldwide and especially in the industrialized countries like the United States. We're thinking of the polluted water, the food, the air. All of these sources can give you heavy metal poisoning. And now I'm going to talk about specific examples of the more prominent heavy metals, their sources as well as the symptoms of their toxicity. First one is a very popular one, lead. Sources typically have included paint chips, dust, lead-based paint, lead soldered canned food, drinking water, inks, plumbing pipes, dyes, newsprint, and leaded glass. The symptoms of lead poisoning include depression, hyperactivity, decreased memory and learning ability, chronic fatigue, insomnia, irritability, reproductive defects, loss of appetite, headaches, and constipation. Now, just to give you an example of what we're up against here, since the Industrial Revolution, it's estimated that lead concentration in human bones has increased more than 500-fold. And we have specific examples. Just about everyone has lead toxicity when we test them for heavy metals after the IV-Chelation Therapy. Just about everyone has lead toxicity. Now we're going to talk about a heavy metal that probably affects at least 85% of the industrialized population. That particular metal is mercury. Sources of mercury include the so-called silver dental amalgam fillings, which are over 50% mercury. Then there's fish, because the oceans have been polluted with mercury. Grains and seeds treated with mercury fungicide, mercurochrome, mercury ointments and antiseptics, felt, floor waxes, polishes, wood preservatives, cosmetics, film, tattooing, labs, air and water around industrial areas. That's very common. Symptoms of mercury poisoning include psychological and emotional disturbances such as apathy, depression, irritability, anxiety, and insomnia. Cognitive impairment such as poor memory, concentration, learning, and gastrointestinal problems, cardiovascular disturbances, immune suppression, autoimmune illnesses, Alzheimer's disease, infertility, fatigue, disorders of the mouth and teeth, and on and on and on. We have seen people get therapeutic responses from mercury detoxification. I've had one patient, for instance, who had sarcoidosis, which is an autoimmune disease, and he had the highest amount of mercury that I've ever seen in my studies. And he had a very positive response to mercury detoxification. The next common heavy metal that we're going to talk about is associated with prostate cancer and emphysema and hypertension as well, and that one is cadmium. Sources of cadmium includes paints, artist paints, commercial or industrial paints, coffee, meat, especially liver and kidney, poultry, grains, dairy, cigarette smoke, colored plastics, fertilizers, fungicides, antiseptics, batteries, refined foods, fish, shellfish. Symptoms of cadmium poisoning, as I said before, include prostate cancer, enlargement of the prostate, cancer in general, immune suppression of white blood cells, high blood pressure, learning disability, fetal growth abnormalities, and emphysema. And I did have a patient who had emphysema, depression, hypertension, and prostate cancer. And I said, that sounds like cadmium poisoning to me. And it was cadmium poisoning. We tested him and then we did appropriate detoxification. The next one we're going to talk about is arsenic. That's been associated with cancer and is also very common. Let's look at the sources. Sources of arsenic include insecticides, weed killers, paint, ceramics, glass, wallpaper, copper smelting factories. Symptoms of arsenic poisoning include hair loss, dermatitis, headaches, fatigue, liver damage, seizures, kidney damage, muscular weakness, degeneration of the nerves in the hands and the feet, and that's a peripheral neuropathy leading to numbness, burning, and tingling. So we find this a very common toxic metal found in 24-hour urine studies after chelation therapy. The next heavy toxic metal is one of the lighter ones, and it's called aluminum. It is the most common metal on the surface of the earth. Sources of aluminum to humans include tap water, cans, antiperspirants, and deodorants. And this is very, very common exposure, And I would suggest everyone look at their deodorants or antiperspirants and throw them away if they have aluminum in them. Aluminum foil, cookware sources, cooking utensils, another common source. Baking powder, antacids, infant formulas, buffered aspirin, white flour, cheese, and food additives. Symptoms of aluminum poisoning include memory loss, learning impairment, dementia, including Alzheimer's disease, brain degeneration, and osteoporosis. So what we have is a picture of multitudes of heavy metals that are inundating our environment and causing various degrees of vague diseases and symptoms, as well as some very serious diseases they may be associated with. Now I'd like to give you some more examples of heavy metal toxicity in our practice here at the Atlanta Clinic of Preventive Medicine. Here I have a Mr. E.W. who had a positive test for early cancer, the AMOS test, showing probable early cancer. And what we did, we detoxified him and found that he had cadmium and lead both high in his 24-hour urine, and we gave him a series of chelations and got rid of the poisoning. And his test, and we did other things as well, but his test reverted to normal, showing no cancer. We have a patient CB who definitely had metastatic cancer of the breast into her lungs, and we detoxified her with the EDTA chelation and found she had arsenic, bismuth, cobalt, gadolinium, titanium, among others, and she has had a very good turnaround. Of course, we used a very holistic treatment with her, and she's had a very good therapeutic response. As well, there's many examples of hypertension and cardiovascular disease that we have chelated these patients, demonstrated cadmium, arsenic, aluminum, lead poisoning, and they have had an excellent turnaround. Furthermore, we've had patients who have had arthritis and gastrointestinal problems who have had very good therapeutic turnarounds. These patients had cadmium, lead, aluminum, cobalt, arsenic, these types of problems. So we have had very good experience in the Atlanta Clinic of Preventive Medicine with the detoxification of heavy metals. So I want to conclude by saying that this is a problem that affects most of us here in industrialized countries, and just about everyone really needs to be detoxed for heavy metal toxicity and needs to be tested just to find out what the load is. We're talking about a problem that most of the doctors are going to miss because they have not been trained along these lines, and frontline tests will not detect heavy metal disease. You have to do a provocative test with the EDTA chelation therapy or another chelator just to find out if you have it stored in your body. Now let's look at some very common symptoms that are associated with heavy metal accumulation in the body. We're talking about fatigue, headaches, depression, emotional disturbances, behavioral disturbances, lower intelligence, diminished memory, dementia, gastrointestinal problems, immune system dysfunction, high blood pressure, liver and kidney disease, and cancer, just to name a few. Looking at more serious illnesses, on the other hand, that can be that the heavy metal toxicity can be a root underlying cause of includes cancer, Alzheimer's, arterial sclerosis or hardening of the arteries, heart attacks, stroke, circulation dysfunction, arthritis, and we said digestive symptoms, multiple sclerosis, and other autoimmune diseases, and depression, and many, many others. Again, this is a very common problem. I urge everyone to strongly consider the recommendation of being tested for heavy metals with the EDTA chelation therapy in the 24-hour urine. This is Dr. William Richardson. I want to thank you for listening.